Good day, Chairman.
I want to make sure, please, that your mic is turned on.
It's on.
Yes.
Good day, Chairman Catania, distinguished council members, and hardworking staff. First, I would like to thank you for your steadfast and long-standing commitment and support of the Whitman Walker Clinic and the LGBT community. I am Dr. Patricia D. Hawkins, a clinical psychologist and the former Associate Executive Director for Policy and External Affairs for the Whitman Walker Clinic. So this is a difficult testimony for me to give today. For more than a quarter of a century, except for my partner, the Whitman Walker Clinic was my life. And I am here today to testify as to what it meant to me and to thousands of people in the LGBT community. I came out as a lesbian in college in the 1960s, when the mere suspicion of being gay got you immediately expelled from school. There was no due process, no need for proof. Your parents were called and you were sent home that same day, disappearing forever from campus. I came out when being gay was officially a mental illness and sufficient grounds for commitment to a state hospital. And I knew people were committed from the time they were 16 to the time they were 21 just for being gay. And the few books available about lesbians were about women who lived tragic lives and usually died by their own hand. And then I came to graduate school here in Washington and was told that only married straight people could do psychological research on LGBT issues, and that if I tried, I would probably not get my PhD and could never work with children or adolescents, which were the areas of my specialization. Needless to say, I went deeper into the closet, and for the next 20 years, I worried every day that I would be outed and forced to leave my job and the career I loved. Truly being gay was still about the love that dare not speak its name. And then the AIDS epidemic exploded in the LGBT community, outing thousands of infected gay men and forcing thousands of LGBT people to risk outing themselves as they came forward to help their gay brothers. And come forward we did, because no one else would. So I volunteered as a psychotherapist at the clinic in 1984, and to this day I remember that interview because it was the first time in my entire professional life that I could say, I'm a lesbian, and I'm a psychologist, and I am here to help. And that was not only accepted, but welcomed for all that I was. I then went on the clinic board representing all the AIDS programs in 1987, and in 1989 I joined the staff as deputy director for all non-medical programs. And those were the most terrible years of the epidemic. We were totally and constantly surrounded by death and dying. In one 2-week period, I went to 10 memorial services for clients, staff, and very good friends. And they did not go gently into that good night. In those days, they died wasting away in their skin, blind, paralyzed, or demented. They died after they lost their partners and their peers. Often they were abandoned by their families, and they died alone without even the comfort of a caring touch, because so many people, including the medical community, were so afraid of AIDS. I remember that almost half the clinic staff and volunteers themselves were HIV positive, and every day they saw their own face mirrored in the lives and deaths of their clients. But they never faltered in the care they gave. Truly, these men and women were the most courageous I have ever known. People like Hank Card, who was a walking skeleton at the very end. And all of them are still missed today. But mostly I remember the clients. I remember one of my first psychotherapy patients, a young gay attorney who had recently lost his partner to AIDS and been diagnosed himself. He wanted to get into clinical trials at NIH, and I told him it would probably cut his life expectancy in half. And he said, Pat, I don't care. I know it's too late for me, but if I can help someone down the road, then I want to try. We got him into a trial, and he died 3 days later from complications that were very severe. To me, these are the often forgotten and still unsung heroes of the epidemic, mostly gay men, black and white, whose exceptional self-sacrifice paved the way for the life-saving medications we have today. And I remember 15-year-old Missy. New York City Social Services sent her to D.C. because no one in her family or the foster care system would take her in. In less than a year, her mother, an IDU, had contracted AIDS and had killed herself by throwing herself off the balcony of their apartment. Missy had had a baby boy who died of AIDS, and that's when she was diagnosed herself, and the father of the baby, an IDU as well, had recently died of AIDS. She was still a child, not yet 16, and now she was all alone in the world, but she never gave up or despaired or turned to drugs. So she came to us, and we placed her in the Whitman Walker Clinic house, where she met and fell in love with Buddy, another HIV-positive resident. And when she was 19, they were married. And Barbara Chin and the housing staff gave her the wedding every girl dreams about, with a long white dress and the wonderful receptions and the flowers. And 2 years later, Buddy and I sat at her bedside at Georgetown Hospital, where she died on her 21st birthday. But before she passed, she told me that since she came to Washington, she'd found everything she had ever wanted except more time. So no, we did not have effective treatments yet, but the staff and volunteers of the clinic, particularly the buddies, made sure that our clients died in dignity and they never died alone. And they had all the care and support that we could muster. And we all took care of each other. We laughed together, cried together, we prayed together. We became a true band of brothers, and we thought we could take on the world. And we followed Jim Graham's visionary leadership. He believed the clinic's job was to meet the community's needs in any way we could. You saw a problem, you developed a program, and you got the funding, and that's what we did. We became a comprehensive, multi-service, one-stop shop, integrating medical care, behavioral health, and social support services into a seamless whole that empowered staff, volunteers, clients, and the community in countless ways that are still remembered by so many of us today. And even in the midst of so much pain and loss, there was still a sense of great and historic accomplishment in what we were doing and in what we were creating. A world-famous institution that embodied all that was good and noble and proud in the LGBT community. And every year at Pride, when we marched into DuPont Circle carrying the clinic banner, we felt the crowd explode with emotion. They were crying and we were crying because the clinic was ours. It belonged to all of us, and we were all so proud of what we had done together to fight AIDS and to make this city a healthier and better place for all LGBT people. The clinic literally changed the way the world saw us and how we saw ourselves. Whitman Walker was our shining star. But still we reached out to share our HIV's expertise and our financial resources with others in need. We went east of the river. We went into Maryland and Virginia. We worked with AIDS service organizations across the globe. And finally we reached out to the Washington Free Clinic. But we never lost our core identity, that of a clinic built by and for the LGBT community. But our mission and services have now significantly changed. In the last 3 years, we've lost most of our LGBT-specific programs, including the Lesbian Services Program, the Black Lesbian Support Group, most of our social support programs like the Food Bank and Bridge Back, our last residential treatment program. The lesbian and transgendered health clinics are no longer separate entities with their own dedicated space and time. And even our gay men's health and wellness clinic, where the clinic began, is serving almost 20% fewer clients in 08 than they did in 07, and only 46% identify as LGBT. In fact, the majority of the clinic's clients are now heterosexual and HIV negative. And after the massive layoffs of our primarily LGBT social workers in January of 08 and the recent layoffs of 45 staff this past December, including all the lesbian senior staff, I would venture the majority of the clinic staff is now straight. So bit by bit, the clinic most of us knew and loved has simply slipped slowly but surely away, and I fear that without a clear and primary return to its LGBT focus, the clinic will soon vanish and be but a fading memory of what once was. And that is a great sadness, because we still need LGBT institutions run by and for our community, for the world is not yet a universally safe place for any of us. LGBT people are still harassed, rejected, and discriminated against in schools, in churches, and in healthcare and employment settings. As adults, we are still often abandoned and disowned by our families, and many of our teenagers are actually thrown out of their homes and lost to the streets. And every single day, we are still dying in disproportionate numbers from AIDS, from hate crimes and violence, from fatal attempts to self-medicate our pain with substance abuse, and from prolonged depression and often suicidal despair. And so I would like to close with a poem from a houseman that honors all those beautiful, wonderful LGBT people we have loved and lost, and all those who still need our help to escape such tragic and senseless ends. With rue my heart is laden, for golden friends I had, for many a rose-lipped maiden and many a light-foot lad. By brooks too broad for leaping, the light-foot lads are laid, the rose-lipped girls are sleeping in the fields where roses fade. Thank you.
Thank you, Dr. Hawkins.